Welcome back. In September 2000, the United Nations launched what became known as the Millennium Development Goals, MDG. These are to end poverty and hunger, achieve universal access to education, achieve gender equality, improve child and maternal health, combat HIV/AIDS, ensure environmental sustainability, and create a global partnership. These goals are to be achieved by 2015. But with only 7 years to go, how is the world doing, and specifically, how is Jamaica doing in achieving the MDGs, that's the Millennium Development Goals? We have with us the country coordinator for UNAIDS in Jamaica. She's also responsible for the Bahamas and Belize. She is Mrs. Miriam Maluwa. We also have with us at this time the director of UNESCO, Dr. Kwame Boafo. We also have Deputy Representative of the UNFPA, the United Nations Population Fund, Jaime Nadal. Welcome, ladies and gentlemen.
Thank you for having us.
Let me begin with Mrs. Maluwa. Fighting HIV/AIDS. How is Jamaica doing? Are we winning the struggle? Are we losing? What?
Well, you know, Cliff, it's not a very simple answer that I could give you, because addressing HIV is quite a complex and long-term process. But where does Jamaica stand at this stage in this process? I think Jamaica has made very significant progress in the area of HIV, particularly in the area of treatment. We now have 18 island-wide centers where people can access antiretroviral therapies, which is HIV treatment, which is free of charge. This has led to a reduction in numbers of AIDS deaths. So we have seen quite a sizable progress in the area of treatment, and therefore
so people are living longer
people
with
are
HIV
living
AIDS.
longer who are HIV positive. Of course, the converse and the catch of this is the encouragement that Jamaica has embarked on to make sure that people are actually getting tested, so that once they know their status, they're able to access this treatment. So, you know, the converse of accessing treatment is to make sure you know your status. And Jamaica is doing quite a sizable amount of work.
How are we doing in terms of reducing the stigma attached to the disease?
Well, stigma and discrimination associated with HIV, regrettably, doesn't only emanate from HIV. It's really grounded in many other pre-existing societal prejudices. So, and this is very important. So what you're really seeing in terms of HIV/AIDS related stigma and discrimination is really the tip end of already existing prejudices. So given that, much as though we have over the last year, particularly with the latest survey that was conducted in 2008 by the government, we have seen that there have been some more tolerant behavior towards people who are HIV positive. We still have quite a high prevalence rates of HIV-related stigma and discrimination. And like I said, largely because the reasons that are propelling them, propelling stigma and discrimination, are prejudices that society have about people with different sexual orientation, about women, about young people, about sex workers, you know, about injecting drug users. So it's really these pre-existing prejudices that people have that then they also use to project within the context of HIV.
A critical issue, though, because yes, we need to build the infrastructure for treating and to reducing the stigma and the discrimination, but the rate of infection, is that trending in the right direction?
Prevention is a problematic area, and I must say that in Jamaica, still a lot we have to do to
You're a classic diplomat. You're not answering me. You're telling me it's a problem.
No.
Is it trending in the right direction or not?
No, diplomacy is my area of work.
Yes.
It's definitely not my habit. So no, absolutely not. So I am not.
So is it trending in the right direction?
On a serious note, it is a very complex area, because prevention relates to changing people's behavior.
Yes.
and people's behavior are very ingrained. So a lot of work has been done in Jamaica to educate people about issues of HIV, how infection can be gotten, how infection can be reduced. However, we know from the studies that we've done that that knowledge that people have has not translated into behavior change.
So the rate of infection?
The rate of infection in Jamaica presently remains stable at 1.5 adult prevalence rate, but that doesn't tell us very much, because in reality that translates to 25,000 people in Jamaica who are estimated to be living with HIV.
And don't even know that.
And I say estimated because we know 60% of the 25,000 do not know that they're infected, which means that they are likely infecting others within their ignorance and within their lack of using protective measures to prevent infection.
Let me turn to Dr. Boafo of the UNESCO. Education, science and culture. What's the main focus of UNESCO in Jamaica?
Well, I think you just mentioned 3 of actually 5 main programs that we're involved in Jamaica, as in the other 15 Caribbean countries that we cover, you know, from Kingston. And let me say that education really is the biggest program, not only in Jamaica or in the Caribbean, but, you know, across the globe, because UNESCO, you know, puts a lot of emphasis and a lot of effort and a lot of resources into helping education. And you did mention the universal access to education, which is really one of the Millennium Development Goals. But apart from education, we are also pretty much involved in culture. And culture here, I think that culture in Jamaica, culture in the Caribbean, is really a major area that we are trying to help, because of the development of the importance, let me say, of the development of cultural industries and the link that has to social and economic development. And then we also do some work in the area of the sciences, the natural sciences, in the area of communication and information. You know, for example, most people may not know that we are actually providing access to knowledge and information at the community level. Okay.
Let me take culture for a moment. I think there's a growing sense in Jamaica that we have a natural advantage where the cultural industries are concerned. But there are still some reticence in the formal financial system to finance and to support cultural activities as an industry, as an area of economic activity. Is that a concern for you? Is UNESCO looking at that?
Yes, I think it is a concern, you know, for us, in the sense that, as I said, the cultural industries are growing industries, and they are of tremendous importance to the economic development of a country. They have impact and relevance to efforts to even get people out of poverty. Precisely. Now, but unfortunately, a lot of people think that, okay, I mean, the support must come from the government. Not necessarily so. I mean, government might set the policies, government might set the directions, government might set the approaches, and perhaps government might even provide some financial support. But you also need a lot of support from outside agencies. What I mean, agencies outside of the government. And this is where we come in, because in our discussions with international development in agencies, we bring this up with NGOs that are outside, that provide support for cultural industries. And then, of course, we also provide some training. For example, we have a project directed at youth, particularly young people in quote-unquote disadvantaged communities.